this occasion, we're going to talk about the big elephant in the room, which we all try to forget from 5 years ago, the big COVID. So the key issues today is whether COVID itself, 5 years down the line, is resulting any impairment of sexual and reproductive dysfunctions, and also whether the vaccine, the big question, is affecting you sexually and reproductively. Let's deal with the short-term problems. We all recall during the infections of COVID, there were many issues. We found out that men who had COVID actually have inflammatory changes in their genitalias, inflammatory changes in the testicle, and also drop in hormone. That itself has three major impacts. Number one, reductions of the libido, because testosterone drops, generally that is the case. And also there's some element of stress as well. Remember that time when you have the lockdown and everything, and that itself probably will put a lot of significant suppression on your testosterone. The second problems after the COVID is inflammation. The inflammatory changes actually impede the blood flow towards the penis, resulting in also erectile dysfunction. Clearly is also influenced by stress. The third problem actually is related to the changes in the testicle. It was found out that men who had biopsied a testicle had significant reduction in the sperm quality. So 5 years down the line, what seemed to be the problems with patients who were affected by COVID? In fact, it depends on the severity of the COVID. The vast majority of us, the COVID itself was transiently causing severe infection, and subsequently we recovered quite well. And therefore, hormonally, reproductively, and also vascularly, we actually have no impact at all. However, people who ended up in ICU may ended up having issues such as erectile dysfunction, mainly due to the suppressions of their reproductive hormone, such as testosterone. So that itself may be carried on as a time go by as a chronic disease rather than a transient inflammatory changes. What about the vaccine? I categorically can tell you that number one, there's no associations of vaccine causing infertility. Vaccine is safe for pregnancy. Vaccine doesn't cause erectile dysfunction. Vaccine definitely does not reduce your libido due to lower testosterone. So the vaccine itself, whichever one you took, has no impact long-term on your reproductive and sexual health. For the following week, we're going to dwell into another big issues of the infection, but this one has no vaccine. This one only have antiviral. We're going to talk about HIV, how is men or women living with HIV is affecting their sexual and reproductive health, and what sort of antiviral treatments available. Stay tuned for next week's Putting Dr. G on the Spot.